This is an historic moment where we have £250 million worth of investment to rejuvenate our hospitals across Stafford and Stoke-on-Trent. Why are we doing that? Well, the reason why we're doing that is we've had a big debate with the public over many months following formal consultation about the need to change health services in Stafford, and we're absolutely committed to develop world-class care for our patients. The decisive moves we're making are going to be made in the next six to 9 months as we transfer some of the services from Stafford to Stoke. But the commitment we made to the public to rejuvenate Stafford still remains, and we are looking to transfer significant numbers of patients back to Stafford, make this a thriving, vibrant modern hospital.
So the Frail Elderly Assessment Unit, it's an emergency portal for older adults who are frail. We set it up in 2010 in the Royal Stoke Hospital. It's an emergency portal, so we have direct access from GPs, from West Midlands ambulances, from any of the community hospitals that require our frail older adults to be seen urgently by a geriatrician, and it's for people who are acutely ill. We're intending to roll out the Frail Elderly Assessment Unit model at Stafford. At the moment we're undertaking a survey to look at the population, just as we did here, and the numbers that would potentially come through a unit like this. So essentially the Frail Elderly Assessment Unit in Stafford, like it is at the Royal Stoke, will be about getting the right care for the right person at the right time.
After January the 19th, for women who are having high-risk pregnancies in the county site, they will be coming up to the Royal Stoke for their births. But all the other services that they access currently will still be existing within the county site. So we will be offering scanning facilities at the county site, consultant-led antenatal clinics, midwifery-led antenatal clinics supported by the community midwifery team. We'll also be offering postnatal clinics, and of course we'll be opening a freestanding birth unit at the county site. I'm really confident that we'll be able to support the extra activity on the Royal Stoke site. We've worked extremely hard over the past 3 to 4 years to maintain the service on this site. In order to enable us to cope with the extra volume of births, we have opened 12 extra beds on the 2 wards, Ward 205 and 206, and we've also adapted one of our high dependency rooms and made it a 2-bedded room.
Currently we have 54 critical care beds at Royal Stoke University Hospital site, and we are planning to increase our critical care beds up to 12 in the near future. And this is to meet the service expansion, including heart surgery, brain surgery, trauma surgery and spinal surgery. So these additional beds will meet the needs of the local population and also allows access for the patients who need critical care in a timely manner, and also allows us to increase the number of heart operations and brain operations. We are a major trauma center, and there's enough evidence to suggest that the outcomes are better when the patients get access to specialist treatment and critical care facilities in a timely manner. And with all these facilities under one roof, there'll be better patient care and also improved outcomes.
This is a really exciting time, and going forward the services are going to look much different, but down at the county site we will have a co-located assessment area next to the accident and emergency department that will be supported and delivered by children's nurses. We will have co-located paediatric appointment next day access clinics, and again they will be delivered by paediatricians that have got years and years of knowledge, experience in delivering that level of service. The developments going forward from bringing 2 centres together, it's really exciting. It means that we're going to have a greater wealth of experience staff to deliver those services to the population that's ever greater now. It's going to bring all our paediatricians together and all the skills and knowledge they've got around specialised services. From a point of inpatient services, that will move to the Royal Stoke, and that's enabling us to open up a 3rd ward. So I can only see this as a really positive outcome and a huge step forward for all of our patients throughout the whole of the locality.